Hello and welcome back to Vicky's case. This is Dr. Jerry Cuomo with the second of several video clips. For you viewers out there, both patients and dentists, we're now adding a very mild acid to the surface of Vicky's teeth. The tooth preparation design, the way these teeth are made and shaped, is such that reflects the amount of porcelain that we're going to use on Vicky's case. Each case is different. Obviously, this is a little more severe case of discoloration, and we're closing spaces as well. So there are a certain amount of requirements by the laboratory technician that in order to give a certain look and a certain result, we do have to reduce more tooth structure. Other cases we reduce less, and I'm sure you've heard of no prep or lumineers. Those are done a little differently as well. So I wanted to show you this more severe case to give you an idea of what we can do to transform a case just solely using veneers versus full crowns. And so now we're rinsing off the etch and cleaning the surface thoroughly, getting it ready for the ceramic bonding techniques that I'm going to be covering shortly. So this video is covering how these teeth now, with the temporaries of the 4 front teeth, are removed, and we're getting ready now to place the veneers, and I'll show you how that's done. So this is tubeless SID that I'm using, and that's a chelator, and now the surface is just about ready. We're going to place the primer and the bonded resin next to each tooth. So I'm slowly painting that on, conditioning the surface, being very careful not to over place these resins. We're doing the 2 front teeth first. We want to align the midline and make sure that they seat properly. So that's also outlined in some of the references that I made and referred to earlier. So now we're going to just dry that off gently. This is a filtered air system. There's absolutely no moisture going to that syringe. So we're drying off the surface meticulously and getting ready to seat the 2 restorations. And so you're going to find out that we're going to lower the light. We're still under the microscope, still seated above the patient. She's already okayed the color and the shape of the teeth. Now we're going to go ahead and use a light. That's a normal halogen light. Today we also have LED lights, which cure a little quicker, but we're basically getting the job done. So light curing surfaces for 20 seconds, and we'll just move on to the next step, which is to seat the veneers now. So this technique could vary amongst clinicians. This video is just to show you how we do it in the office, and so here we are. Lights are off now, and we're going to go ahead and paint in our adhesive. I'm doing that with the microscope. Again, careful not to put too much on, and then we'll load that with our dental adhesive. I believe we're using Verilink 2 from the same company that makes the ceramic material, Dentist-Porcelain, and that actually was 2 people involved in the making of Dentist-Porcelain, both a dentist and a laboratory technician that are affiliated with Ivoclar, and I'll try to remember their names for the next video clip and give you those names. But Design, it's small d period Zine, I believe that's the type of porcelain. Here I am drying off the surfaces, just thinning down the adhesive, and now we're going to come right on in with the veneers. First of all, we're going to protect the adjacent teeth, so we're just going to put a little barrier there right now. And here comes number 8. We'll seat that both I'm going to seat it in two ways. Seat it straight down toward the gum line and also toward the tooth itself. And yeah, I'm just going to make sure that the excess is removed and we're not getting anything on the adjacent teeth while we're curing both central incisors first. So we'll bring in the other veneer next, and then we'll do a meticulous cleanup using both the Bendix brushes as well as a rubber tip stimulator, and then we'll tack them in momentarily, and then after they're tacked in with the light for about just a few seconds, then we'll run some floss through there and eventually clean up the excess and place our OxyGuard, and then do a thorough light curing and then clean up. So get the two centrals in, clean them up, and then move on to the next step. So just spending a little extra time making sure we're seating the first one. Once these two are placed, the rest of it goes pretty quickly. Again, we're just working with very low light now, just going with room light. Really don't want anything to set prematurely, and allowing that a misseat at all. So you don't want to rush through this part of the procedure. Patient is again, she's anesthetized. Some patients do want to be numb for this, some don't. We're through the tooth preparation phase. We're just seating these veneers, and again, she wore her temporaries for a good solid 2 months and was very comfortable with them, and now we're putting in the final restoration. So again, I'm just brushing lightly with the Bendix brush. I'm looking now at the lingual and just very gingerly just removing some of the excess to give myself a little less time of a cleanup. There are other techniques out there. Here's the rubber tip I was referring to. A great way to clean interproximal cement. Just going gently on top of enamel only right now, just cleaning off the excess. Again, just verifying the fit, and just gently going in and around the contours and slowly removing the cements. So there we have them in place, lights up now. We're getting ready to tack them in. This is Dr. Jerry Cuomo here at my private office. If you want to get a hold of us, our phone number at the office is 561-391-6290, and you can reach us on the web at www.gcuomodds.com, and we'll look forward to seeing you on the next video clip, which will now cover the rest of the veneers. So we'll see you then. Take care.